More than half the adults in the U.S. have been inoculated with at least one dose of a COVID-19 vaccine. But daily vaccination rates are now declining across the nation. For the first time since early March, the daily average of doses administered across the U.S. dropped below 2 million, with nearly 300 million doses administered nationwide thus far. Medical professionals now believe it is unlikely that the U.S. will reach herd immunity. Meantime, some states are now turning down new shipments of vaccines. And this comes at a time when many foreign countries have fallen behind on their vaccine distribution rollouts. The Biden administration is also under increasing pressure to share its supplies with hard-hit countries like India. With more on this, let's bring in Dr. Julie Morita. She's the Executive Vice President of the Robert Wood Johnson Foundation and the former Chief Medical Officer of the Chicago Department of Public Health. Dr. Morita also served as a member of the Biden-Harris administration COVID-19 Transition Advisory Board. So we have been talking about the possibility of reaching herd immunity since the pandemic broke out last year. Help our audience understand and reintroduce us to the idea of what herd immunity is and whether or not you believe we will actually ever get there.
So herd immunity is the level where we feel like the disease will actually stop being transmitted from person to person. And because COVID is an emerging and new disease, we don't actually know exactly what that threshold is. So what we've heard is people predict between 70 and 85% of the population should have immunity either from vaccines, from natural infection itself, in order for us to stop that transmission. I think what we need to really focus in on is really just getting as many people as possible vaccinated as quickly as we can. And we've done a really good job. As you pointed out, nearly, over 50% of adults have actually been vaccinated already with at least one dose. So we've made great progress. But things are slowing down, and there's fewer and fewer people who are ready to accept the vaccine without question. And so I think the work really needs to focus in on understanding those people who are hesitant or who have questions about the vaccine or don't have the confidence they need to have the vaccines and to receive them. We need to understand what's going on with them and then work with them to address their questions so they will actually get vaccinated. We are striving to have the highest levels of vaccine coverage that we can achieve, and that will help us to stop transmission, but we really need to work with communities to understand what information they actually need.
So, Doctor, last week, President Biden said that he really felt like the next phase of his administration's fight against COVID-19 was going to be harder than the first 100 days. And maybe, that's partially due to what you were just mentioning, that there's certainly a core group of people, or at least a group of people who are either hesitant or it's just not a top priority for them to get vaccinated. Also, perhaps, with more and more places opening up, people are sort of sick and tired of the social distancing. Maybe that's part of it. But sort of give me an idea of why the road forward may be particularly challenging and what the administration needs to focus on in terms of their strategy.
I think we have to focus in on earning the trust of people who don't have confidence in the vaccines. As a pediatrician and a public health person who worked in immunizations for many years, there were people who had questions and concerns about vaccines, and you can't always address those overnight or really quickly. It takes conversations and discussion, bidirectional communication, so we really understand what is the information that people need and who do they really want to hear from. And so that takes time. So when the demand for vaccine is really high and everybody wants the vaccine, we can act quickly and get the vaccines out there and motivate people and make them as accessible as possible. But to really get to these deep-seated concerns about the vaccines, whether it's safety, efficacy, or just not hearing from the right people, that's going to take some time and effort. What I'm pleased to see is the administration is investing resources and dollars into community to get that community members out to work with others to answer their questions and to find out who they want to hear from, who are the trusted messengers, so we can actually get the issues addressed and people will feel more confident in the vaccines themselves.
Doctor, can you describe how you have felt just as a medical professional, as a doctor, over the course of the last several years in watching people in this country become vaccine hesitant? And I ask that because of what we're seeing happening in India, right? So in the United States, you're seeing numbers of people who want to get vaccinated dropping, and there are countries who are struggling enormously with coronavirus, who don't have access to the vaccines that we do. It's interesting, we spoke, Anne-Marie and I, last week to somebody who talked about how the U.S. is now lapping. We were sort of late in getting our handle around the pandemic, but now we're lapping other countries in terms of the availability of vaccines, and we're finding out that many people don't want them. And I always describe my experience when I was a foreign correspondent in Nigeria, which at the time still had polio. It was one of 3 countries in the world that still had outbreaks of polios. And when I would talk to them about vaccine hesitancy in the United States, this is before coronavirus, they were shocked. They sort of looked at me, people in villages whose children were deformed, that they would love to have access to the technology and the medicine and the science that is available readily to those of us who are privileged enough to have access to those things. And I just want to know from your sort of viewpoint, just as a doctor, what that's been like. I mean, presumably when you perhaps started in medicine, it wasn't like this.
Right. So I think what happens is when we see the disease and we see the negative impacts these infections can have on people, it's highly motivating. And so people want to get the vaccines and don't question the safety of vaccines, so don't question potential side effects that might be associated with vaccines, because we see the reality of the disease. And that's what's happening in countries like India right now, where there's just huge surges of disease. But in the United States, things have calmed down a little bit. So as a result of that, that fear factor has really been diminished. So I think it's really important for us to really encourage people to reflect back upon how bad it was this winter, and that we could get back to those levels if we're not careful. So as much as you hate to reflect back on the negative past, I think it's important for us to remind ourselves that these diseases are there, and that it's not that far from that we aren't that far from them coming back and causing us more problems. And so it's a matter of reminding folks of that. The other thing I think is really important for us to remind people of is the advantages of getting vaccinated. I celebrated Mother's Day this year very differently than I did last year. I was able to be in my parents' home because we've all been vaccinated, and have a dinner together and talk and have conversations like were unable to have last year. I'm able to exercise outside without a mask comfortably. And I think those kinds of things are really important to lift up to folks who are questioning the vaccines, to say, look at what's happened in terms of disease because we have such high vaccine, we're improving vaccine coverage levels. Disease rates are going down, and that's really good. We need to keep that energy and momentum going, and other people need to get vaccinated so everyone is protected, and then we can all enjoy these freedoms that we've not been able to enjoy in the past year.
Doctor, I know that there's been a lot of discussion about hesitancy, but it's also, part of the issue when we see fewer people seeking out the vaccine is just sort of access. And access doesn't always necessarily mean I have to drive an hour to get it and I don't have a car. It might mean I work 3 jobs. And so even though the vaccine's available, pretty close to my house, I don't have the time, and it can't be a priority to me because my priority is paying the rent. Is that also kind of part of what we're dealing with?
Yeah, Anne-Marie, thanks so much for bringing that point up. I think we often forget about that and focus in on just this hesitance issue, and people don't want the vaccine, but there still are people who haven't been able to take the time off of work or to get vaccinated because it hasn't been easy for them. And so what I'm pleased to see as well is that many of the jurisdictions and states are really focusing on making sure that vaccines are in the communities, so getting them into by mobile units, or having after-hour clinics or weekend clinics, so they're easily accessible to people who have to work, who can't take time off from their job, or who can't drive an hour to get the vaccine. So access to vaccines is critically important, in addition to working with communities to address their questions and concerns, and being patient, because I know I wasn't able to address my patients' questions and concerns in one visit. Sometimes it took numerous visits. And so having conversations and having them repeatedly and making the vaccine as accessible as possible, it requires all those things to make sure that people get vaccinated and vaccinated as quickly as we can.
Dr. Julie Morita, thank you so much.
Thank you.